Did you know before a baby is born, the testicles first develop inside the belly? As the baby grows, the testicles travel through two tunnels called the inguinal canals and usually reach the scrotum by the time the baby is born. The reason why the testicles are in the scrotum is to keep them cooler than the rest of the body. The testicles can move up and down in the scrotum and are very mobile. The testicles are particularly mobile during times of stress. Some stressful situations that can make the testicles mobile are during an exam by a doctor, when crying, or if the temperature in the room is too cold. This is a normal reflex in the body. However, undescended testicle, or cryptorchidism, is a condition when one or both of the testicles are not seen or felt in the scrotum consistently. The testicle can be found any place in the path to the scrotum, such as in the belly, the inguinal canal, just outside the inguinal canal, or in some other location. 4 out of 100 full-term babies are born with an undescended testicle. Premature babies are more likely, with 1 in 5 premature babies having an undescended testicle. In many boys with an undescended testicle, the testicle moves into the scrotum by the time the baby is 3 to 6 months old. In this case, the boy does not need any further treatment. Having a specialist examine your child is the best way to diagnose an undescended testicle. Ultrasound or other imaging studies are not recommended, as they are not reliable ways to find the testicle. If the testicle has not moved into the scrotum by 6 months of age, the best treatment is surgery. Why should you consider surgery for your child? Undescended testicles can be linked with several issues that can be prevented or corrected with surgery. Undescended testicles can be associated with an inguinal hernia, which is when fatty or intestinal tissue moves into the inguinal canal. It can also be linked to testicular torsion, which is when the testicle twists. Boys with an undescended testicle have a greater risk of developing testicular cancer later in life if the undescended testicle isn't corrected through surgery. You may have concerns about your child's fertility or ability to have children. The good news is the chance of boys with this condition growing up and fathering a child with 1 undescended testicle is the same as the rest of the population. However, the fertility of children with 2 undescended testicles may be affected. What happens if the doctor does not find one of the testicles during the exam? In about 1 out of 5 boys, the undescended testicle isn't found during the exam. In that case, the child may need a diagnostic laparoscopy, which is a procedure where a thin tube with a camera at the end is passed through a small opening in the belly button. Sometimes, an undescended testicle can't be found even during laparoscopy. This is due to an event that occurs while the baby was forming in the womb, which causes the testicle to vanish or stop forming. This is called a vanishing testicle. If you have more questions about undescended testicles, please write them down and feel free to ask them to your doctor.